Well, National Health Minister Dr. Angelique Cotzee has, of course, given us those numbers. 240 healthcare workers died from coronavirus as of the 4th of August. The public sector accounting there for 203 deaths and 37 deaths from the private sector, with over 31,000 healthcare workers having contracted COVID-19. What is the morale of frontline workers as they fight against this pandemic, while also trying to stay safe amid allegations of shortages of PPEs? South African Medical Association Chairperson Dr. Angelique Cotzee joins us now to discuss that and more. Dr. Cotzee, good evening, and thank you very much for your time tonight. Hearing that message there, if government had prioritized the safety of healthcare workers, we would not be talking of 240 healthcare professionals who have died. Do you think government did enough?
Good evening. Yeah, this is a very, very difficult question. It depends to whom you are talking. Government will say, yes, they did enough. And if you are speaking to the average doctor and nursing staff out there, they will tell you, no, they don't think so. So it's a case of who's having the seat right now. But if we look carefully at this, South Africa doesn't have a lot of healthcare workers or doctors. So even the death of one doctor or nurse is one death too many, and it should not happen. And right from the beginning, when the PPE was distributed, we were not aware, I don't think government were aware of the poor quality that was distributed to the healthcare workers, regardless whether it's a doctor or a nurse. We only started to notice that there was a problem when the healthcare personnel started to get infected more than what we would normally expected. And then subsequent to that, there were tests done on the quality of especially the masks and the gloves that was being provided, whether it is by donations or being bought from tenderpreneurs. And that's when part of the corruption also started to emerge, that it then became clear that a lot of these PPE were of poor quality. And again, we have not been previously been aware of this, as there was always enough PPE to use, especially in the ICUs. So when we started to test, one of the problems is, if you look at the masks, there's not an identifier on the mask telling you which company is supplying that mask. So it then becomes quite a problem, because the company will say it's not my mask, and no one will take responsibility. So there will be a policy coming for within the next few weeks, which will describe what needs to be on mask and protective gear, so that we can handle this problem.
Yeah.
Also remember, it's not unique to South Africa.
Right.
It is worldwide.
The corruption is being reported that worldwide, the PPE corruption has been a thing to look at during this time of the pandemic. But Dr. Cotzee, looking at the numbers, right, and the work that has been put in, for example, if you look at the number of tests, total tests conducted in the private sector, 2,113,000. In the public sector, 1.6 million. So 57%. Is the total number of tests conducted in the private sector, 43% in the public sector. So they're doing more tests, more work is being done. But if you look at the infection rate and the death rate, you find that the infection rate in the public sector is higher, and the death rate is higher than it is in the private sector. What does that tell us about the health system in this country?
Okay, one of the, if you look at it, one of the conclusions you can be drawn from this is to say that there are more tests done. I don't want to use the term unnecessary, because for a patient it is never unnecessary. But there were more tests done in the private sector, which maybe didn't have the indication of having a COVID-19 disease underlying. We knew that there was, in the beginning, a lot of patients that didn't go through any channels but self-refer them to, but it's self-referral to the pathology labs in the private sector, right, until we started to address that. So in the public sector, on the other hand, there could have been an under testing of patients who have actually has the symptoms, but due to a lot of different reasons was not tested, but it still remains that they were more positive than the ones in the private sector. Mm-hmm. So it depends on, but you will see going forward that there is not a lot of patients in the private sector that will test anymore because they run out of medical funds. Yeah. This time of the year, the medical funds are depleted. Patients cannot afford to pay 800 Rand. Also going forward in the public sector where the NICD in the past sponsored these tests. From now on going forward, it will be the responsibility of the said hospital in the public sector that would need to foot the bill. So I'm not sure what is going to happen with that type of testing going forward because of money, lack of money. There will be a money issue.
Now, as a professional body representing doctors in particular, you're looking at the corruption around PPEs and you want to do something about it. So tell us a little bit more about your whistleblowing initiative.
Yeah, we started a whistleblower initiative about 2 months ago. It's totally, not even me knows who the complaining doctors are. And each and every complaint that we received were escalated to the Minister who then sent it to the various provinces. One of the things that became very clear is not only a lack of PPE that was a problem, but a lot of hospitals also complained that there's not running water, and then the facilities in which they need to see the patients, especially in the casualties, didn't allow them with the 1.5 meter distance, and then the poor ventilation systems. So it makes it extremely difficult then to try to address, especially where there's an overcrowding in a examination room due to the infrastructure that was not developed. When these hospitals were built many years ago, there was no such a thing as COVID. So it don't make, a lot of the older hospitals doesn't make provision for the 1.5 meters with dire consequences again. So if you don't have enough space and if you don't have the proper gear, or if you now say proper gear, the legitimate gear, not the substandard ones, it really makes for infection to occur, and that is also one of the problems. So yes, there's still hospitals that is not fully operational regarding the PPEs, but infrastructure also a huge problem, and that needs to be addressed. With any new hospital design or development, they should look at distances, especially in the cases where there might be a possible outbreak, especially new viruses. Remember, this virus is not going to go away within the next few months. It's going to stay here for quite some time to come, and we need now to learn how to live with this virus. But also more of a concern to SAMA is not only the fact around the PPEs and the hospital infrastructure, but also we don't think there's enough counseling from National Department of Health or Provincial Department of Health to their hospitals and also in the public sector. A lot of these healthcare people has been confronted with severe traumatic experiences with patients dying of COVID-19. And the post-traumatic impact is going to play a huge role. So that's another thing that, please, so from some side we plea with National Department, Provincial Department of Health, and private sector hospitals.
Yeah.
Please get psychiatry or clinical psychologists in to evaluate your personnel. Make sure that there is no post-traumatic stress syndrome.
And we